Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I came in because the pain's been unbearable lately, and it's really affecting my daily life. I've had back problems for years, ever since my surgery back in '68, where they removed a disc from my L5. It's never been the same since then, and now it feels like it's just getting worse with age.
I understand that must be very difficult. Can you describe your current pain and how it affects your daily activities?
Sure. The pain is mostly in my back and my SI joints. It's a mix of dull throbbing and sharp stabs that just come out of nowhere. The sharp pains are particularly bad when I try to move around, making it hard to even walk sometimes. I have to use a cane, and dressing myself has become a real challenge. Just the other day, I couldn't bend over to tie my shoes because of the pain. And if I stand or walk for more than a few minutes, it just gets unbearable.
That sounds extremely challenging. You mentioned using a lumbar belt at night. Does that help at all?
It does help a bit, actually. It seems to take a little pressure off and gives me some relief, but it's not enough. I'm not on any pain meds right now because I stopped taking naproxen after the prescription ran out. I've been trying to manage without it, but some days are just really tough.
I see. And how about your sleep and overall mobility?
Sleep has been rough. I barely get a few hours before the pain wakes me up, and I have to shift around to try and get comfortable again. Mobility is just as bad. I need the cane to walk, and even with it, I feel unstable. The numbness in my toes doesn't help either. It's like they tingle all the time unless I take my socks off, which is just weird.
Have there been any changes or anything new in your symptoms recently?
Well, the numbness in toes is relatively new, and the sharp pains seem to be happening more frequently. It's not just in my back now. I get these sudden jolts in different parts of my body without any warning.
And regarding your medical interactions, have you discussed these new symptoms with any other healthcare providers recently?
Yes, I saw a doctor about it, and they prescribed some blood pressure medication and something to help me sleep, but nothing specifically for the pain. We did some blood tests too, and I've been scheduled for an MRI and some X-rays to see what's going on with my spine now.
It's good that you're having those tests done. It will give us a clearer picture of what's happening and help in managing your condition more effectively. Have you considered any other forms of treatment or intervention?
I'm open to options. The doctor mentioned trying physical therapy and maybe a sleep study because of my snoring and poor sleep. I just want something that will give me a more permanent solution. I'm even willing to consider surgery if it means getting my life back.
That's understandable. Let me go over your current clinical values and then we can discuss the next steps in your treatment plan. Your blood pressure today is 158/92, which is a bit high. Your heart rate is stable at 78 beats per minute, and your respiratory rate is normal at 16 breaths per minute. Your recent lab results show that your kidney function is stable, but we'll keep an eye on your creatinine and BUN levels. Your blood glucose and cholesterol are slightly elevated, and your thyroid levels suggest that we need to adjust your medication. Your vitamin D is low, which is common in individuals with limited mobility and could be contributing to your pain and muscle weakness.
What do you suggest we do moving forward?
First, we'll proceed with the MRI of your spine and the scheduled X-rays. This will help us assess the extent of any structural changes or issues that might be contributing to your pain. Based on the results, we can consider whether a new or adjusted medication regimen might be appropriate, and I would recommend starting on a vitamin D supplement to address the deficiency. Physical therapy is definitely a good option as it can help strengthen your muscles and improve your mobility, which might reduce the pain. We'll also plan for a follow-up appointment to review all your test results and discuss potential surgical options if necessary.
Thank you, doctor. I appreciate your help. It's been tough, but I'm hoping we can find a way to manage this pain better.
Absolutely. We'll do everything we can to improve your quality of life. I'll make sure we follow up closely on your tests and treatments. Let's plan to meet again after your MRI.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been quite anxious about the recent findings of my lung nodules. I had cancer once, and although it was a long time ago, it's still fresh in my mind. That's making me worry about these nodules a lot.
I can understand why you'd be worried, especially with your past medical history. It's important we address this carefully. Can you tell me more about any symptoms you might have experienced recently?
Well, apart from the usual issues with my diabetes and neuropathy, I haven't noticed anything specific that could be related to my lungs. But my feet have been bothering me more than usual, and my blood sugars have been erratic. Sometimes it feels like everything is just piling up.
Let's go through everything step by step. How has your diabetes management been going, particularly with your insulin adjustments?
It's been challenging. I was on 30 units of insulin glargine, but my doctor adjusted it to 32 units recently because my fasting sugars were consistently high. My last few readings in the morning have been between 135 and 140 milligrams Bel-Ehlers, which is higher than what we aimed for. I've also been seeing a nutritionist to manage my weight, which has been fluctuating a lot.
Weight management is crucial in diabetes control. How about your diet? Have there been any significant changes or difficulties?
Yes, actually. The dietary changes are not always easy to keep up with, especially when my appetite varies so much. It's a balancing act with what I should eat, keeping my weight in check, and managing my blood sugar levels. And on top of that, my neuropathy makes it hard to stay active.
That sounds quite challenging. You mentioned earlier some issues with your feet.
Yes, the peripheral neuropathy has been worse lately. My feet are constantly numb and sometimes painful. It's affecting my daily activities. I've been to a podiatrist for this before, and I use gabapentin, which was recently adjusted, but the discomfort is still significant.
It's important to manage that pain effectively so it doesn't restrict your daily activities too much. I noticed you're also on terazosin, simvastatin, aspirin, and a few other medications. How have you been managing these?
To be honest, it's getting confusing. The terazosin was prescribed, but I'm not entirely clear on its purpose anymore. As for the aspirin, I'm worried about having to stop it if surgery for the lung nodules becomes necessary.
We'll definitely review all your medications today to ensure everything is clear and appropriate for your current health needs. Now, about the lung nodules. When is your next appointment for that?
I have a follow-up with hematology-oncology next week. They mentioned possibly needing a biopsy to understand more about the nodules.
Good. That's a crucial step. We need to have a clear understanding of what we're dealing with. Let's also discuss your upcoming cardiology appointment. They might consider starting beta blockers, depending on your overall heart function and stress levels.
Yes, that's another concern. There's just so much going on, and sometimes it feels overwhelming, especially with my partner and I trying to keep track of all these appointments and what each medication is for.
I'll make sure today we clear up any confusion and align your treatment plan correctly. Now, let's review your recent labs and clinical findings to see how we can optimize your treatment going forward. Based on your current symptoms and the medical history you've provided, here's what we have from your recent evaluations. Your blood pressure is stable at 130/85 mmHg, and heart rate is normal. Your respiratory and heart functions appear stable from the EKG and chest X-ray, though the nodules need further investigation. Your diabetes control needs tighter management given your hemoglobin A1C is at 8.8%, which is higher than our target. Your kidney and liver functions are within acceptable ranges, but we'll continue monitoring them closely due to your medications. For the neuropathy, we'll continue with the medication, and I'll adjust the dose to better manage your pain. As for your insulin, we might need to tweak it further, depending on your daily blood glucose readings and the results of your upcoming tests. We will schedule your labs before any surgical intervention to ensure your comprehensive health status is up to date. I'll also coordinate with your cardiology and oncology teams to ensure they have all the information for your upcoming appointments. Regarding the medications, I'll clarify each one with you today and make sure you and your partner feel confident in managing them.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We've been seeing an uptick in COPD exacerbations recently. What are the main symptoms you've observed in these patients?
Many patients are presenting with increased shortness of breath, more frequent and severe coughing, and changes in their sputum, which has become thicker and more copious. Several have also mentioned feeling more fatigued than usual.
Yes, those symptoms are consistent with my observations as well. Have you noticed if there's any correlation with environmental factors or medication compliance?
It seems the colder weather and increased air pollution might be aggravating their conditions. Also, a few patients admitted to missing doses of their medications, which could be contributing to the severity of their symptoms.
Good insights. Let's ensure that these factors are addressed in our treatment plans. Increasing their inhaler use might be necessary, and perhaps more regular spirometry tests could help us monitor their lung function more closely. I'll also check their medication adherence during my rounds.
I will coordinate with the respiratory therapist to optimize our approach and ensure all patients receive tailored care based on their current symptoms and overall health status.
Now look at question 26.
Good morning, everyone. Today I'm here to talk about managing polypharmacy among our elderly patients. As you are aware, older adults often require multiple medications, which increases the risk of drug-drug interactions and side effects. One effective approach is to conduct regular medication reviews. This involves evaluating all the medications a patient is on to ensure that each is necessary and that the benefits outweigh the risks. We should also emphasize the importance of adherence to guidelines like the Beers criteria, which can help in identifying potentially inappropriate medications for older adults. Engaging patients and their caregivers in discussions about their medications is crucial. They need to understand the purpose of each drug, recognize potential side effects, and know how to properly manage their medication schedule. Collaboration among healthcare providers is essential. As geriatricians, we need to communicate with pharmacists, nurses, and specialists to ensure a cohesive approach to medication management, which in turn enhances patient safety and improves outcomes.
Now look at question 27.
Managing medications for both chronic kidney disease and heart failure requires careful coordination. Let's review your current prescriptions to ensure they are optimized for both conditions. For your heart failure, maintaining fluid balance is crucial, which is why you're on a loop diuretic. However, we need to monitor your kidney function closely because this type of medication can affect renal blood flow. Your ACE inhibitor is excellent for protecting your kidneys and supporting heart function. But again, we must regularly check your potassium levels and kidney function to avoid any potential complications. Dietary management is also essential. Avoiding excess sodium will help manage your heart failure, while being mindful of protein intake is necessary for your kidney health. I recommend keeping a daily log of your fluid intake and weight. Any sudden changes should be reported immediately, as they can indicate fluid retention or worsening heart failure, which require prompt adjustment in your treatment plan.
Now look at question 28.
Today we'll focus on preventing ventilator-associated pneumonia, a major concern in hospital settings, especially in intensive care units. One fundamental measure to avoid this is to maintain strict hand hygiene among healthcare staff. In addition, we need to ensure that all equipment is sterilized properly before and after use to prevent bacterial transmission. Elevating the head of the bed between 30 to 45 degrees reduces the risk of aspiration, which is a key factor in the development of pneumonia. Regular oral care with chlorhexidine can also decrease the incidence of ventilator-associated pneumonia. Another important strategy is the daily evaluation of the necessity of mechanical ventilation. The sooner we can safely wean a patient off the ventilator, the lower the risk of developing pneumonia. Implementing a sedation vacation and reassessing the need for continuous sedatives are critical components of this approach. This not only helps in reducing the length of mechanical ventilation, but also improves overall patient outcomes by reducing pneumonia risks.
Now look at question 29.
Let's discuss the new symptoms you've been experiencing. How have these been affecting your daily life?
My tremors have gotten worse, and I feel stiffer in the mornings, which makes getting started with my day very difficult. My movements are slower, and I've noticed that my balance is off too.
It sounds like your Parkinson's symptoms are progressing. We might need to adjust your medication regimen. Have you been able to take your medication on time every day?
I try to, but sometimes I forget the afternoon dose. I've noticed that my symptoms seem more pronounced on those days.
Consistency with medication is crucial for managing Parkinson's effectively. Let's explore using a medication dispenser or setting alarms as reminders. Additionally, I would like to schedule some physical therapy sessions to help with your mobility and balance.
That sounds helpful. I've been feeling quite overwhelmed with managing everything. Any support to make this easier would be greatly appreciated.
Now look at question 30.
Improving equity in healthcare access is essential, particularly in underserved communities. Today, we'll explore strategies that can help us achieve more equitable healthcare delivery. Investing in infrastructure in rural and underserved areas is crucial. This includes not only physical healthcare facilities, but also the technology necessary for telehealth services, which have proven invaluable, especially during the pandemic. Telehealth can dramatically improve access for patients who live far from healthcare centers or who have mobility issues. It's essential that we continue to support and expand these services post-pandemic. Community health programs focusing on preventive care can reduce the need for emergency care and hospital admissions. These programs should be culturally sensitive and tailored to meet the specific needs of the community they serve. Advocating for policy changes that ensure healthcare funding is distributed equitably is vital. We must work together to influence policy at both the local and national levels to ensure that no one is left behind in our healthcare system.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we're going to explore Guillain-Barré syndrome, GBS, a complex, rapidly evolving polyneuropathy that often requires swift medical intervention. Let's use a detailed case study to understand the clinical nuances and management strategies for this condition effectively. John, a 45-year-old teacher, presented with progressive weakness in his lower limbs, which he first noticed 4 days ago as a slight tingling in his toes that escalated to a significant difficulty in walking. He described the weakness as ascending, now affecting his upper limbs, accompanied by mild sensory disturbances like numbness. Notably, John reported a gastrointestinal infection 2 weeks prior, which is relevant as such infections can precede GBS, potentially triggering an autoimmune response that mistakenly attacks peripheral nerves. In assessing John, the initial focus was to rule out other causes of acute weakness, such as spinal cord compression or a stroke, through a comprehensive neurological examination and imaging studies. Once these were excluded, attention turned to confirming GBS. A lumbar puncture was performed, revealing elevated protein levels with a normal white blood cell count, a classic sign of GBS known as albuminocytologic dissociation. Further diagnostic confirmation came from nerve conduction studies and electromyography, which showed slowed conduction velocities and conduction block, typical of the demyelinating form of GBS. The immediate management for John involved admitting him to a neurological intensive care unit due to the rapid progression of his symptoms, highlighting the unpredictable nature of GBS and the need for close monitoring. Treatment commenced with intravenous immunoglobulin, IVIG, chosen over plasmapheresis, which involves filtering the blood, because of its availability and John's cardiovascular stability. IVIG is thought to work by modulating the immune system, reducing the harmful antibodies that contribute to nerve damage. Supportive care in GBS is paramount, as complications can include respiratory failure, autonomic dysfunction, and deep vein thrombosis due to prolonged immobility. John was closely monitored for respiratory function, and mechanical ventilation was on standby. Cardiovascular monitoring was crucial to manage potential fluctuations in heart rate and blood pressure caused by autonomic nerve involvement. Rehabilitation started early in John's treatment process, focusing on maintaining muscle strength and flexibility, which are crucial in the recovery phase of GBS. Physical and occupational therapists worked with him daily, adapting the interventions as his condition improved. Discussing prognosis with patients like John involves careful consideration. Although most patients with GBS recover significantly, the recovery can be prolonged and sometimes incomplete. We informed John that while the majority of patients start to notice improvement within weeks to months after treatment initiation, the full recovery can extend up to a year or more. We also prepared him for potential long-term effects, such as residual weakness or sensory changes, which some patients experience. One of the critical aspects of managing GBS is patient education and psychological support. Patients can experience significant anxiety and depression due to the sudden loss of independence and uncertainty about their recovery. Regular counseling sessions were arranged for John, providing him with strategies to manage stress and adjust to the temporary changes in his life. Guillain-Barré syndrome is a medical emergency that requires a multidisciplinary approach for optimal management. From acute medical treatment with IVIG or plasmapheresis to meticulous supportive care and a comprehensive rehabilitation program, each step is crucial for the patient's recovery. The case of John exemplifies the challenges we face with GBS and underscores the importance of prompt diagnosis, effective treatment, and holistic patient care. Understanding the pathophysiological mechanisms, recognizing the clinical presentation early, and implementing a coordinated treatment strategy are key to improving outcomes for patients with this unpredictable and often severe condition. John's case offers vital insights into the practical aspects of diagnosing and managing a complex neurological disorder, emphasizing the need for vigilance and a proactive approach in medical practice.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello everyone, and welcome to today's detailed discussion on the ethical and practical complexities of palliative care, focusing particularly on how medical professionals navigate the delicate balance between prolonging life and enhancing the quality of remaining life. Our conversation today is centered around a case study that illustrates these challenges vividly, featuring Mr. Thompson, a 78-year-old patient with advanced pancreatic cancer. Mr. May Thompson's journey with cancer has been long and arduous, marked by numerous treatments, including chemotherapy, radiation, and targeted therapies. Despite these efforts, his condition has worsened over time with metastases to his liver and lungs. Importantly, Mr. Thompson has reached the decision point where he prefers to avoid further aggressive treatment that might extend his suffering without providing substantial benefit. This decision highlights a critical aspect of palliative care, aligning medical interventions with patient values and preferences. The ethical framework guiding decisions in palliative care encompasses four principal tenets: autonomy, beneficence, non-maleficence, and justice. Each plays a crucial role in how care is structured and delivered in cases like Mr. Thompson's. Autonomy demands respect for Mr. Thompson's right to make informed decisions about his care, emphasizing the need for clear and open communication about his treatment options and likely outcomes. Beneficence compels the care team to act in the best interest of Mr. Thompson, striving to maximize benefit while minimizing harm. Non-maleficence is the commitment to do no harm, guiding the team to avoid or minimize interventions that could potentially lead to unnecessary suffering. Justice requires that Mr. Thompson receives equitable care, ensuring that he is treated with the same consideration as any other patient under similar circumstances. A critical element in respecting these ethical principles is effective communication, which is facilitated through tools like the respect form. This form serves as a structured means for Mr. Thompson to articulate his preferences regarding end-of-life care, ensuring that all medical decisions are guided by his personal values and desires. During consultations, Mr. Thompson expressed a clear desire to focus on quality of life rather than aggressive treatments with unlikely benefits. This discussion, documented via the respect form, includes his consent to receive palliative measures aimed specifically at pain management, symptom control, and maintaining comfort. This approach not only respects his autonomy, but also aligns with beneficence by prioritizing interventions that provide the most quality to his remaining life. Implementing Mr. Thompson's preferences requires a nuanced approach known as anticipatory care planning. This strategy involves preparing for future healthcare needs and potential emergencies, ensuring that any medical intervention aligns with the patient's current health status and his articulated care preferences. For Mr. Thompson, this means his care plan includes regular assessments by pain management specialists, nutritional support to manage weight loss and energy levels, and arranging for hospice care services that can provide comprehensive support in a comfortable environment. Anticipatory care planning is not a one-time effort, but a dynamic process that needs regular updating to adapt to the patient's evolving condition. As noted in the Harvard Health Policy Review, continuous dialogue is essential, allowing the care team to remain aligned with the patient's changing needs and preferences. This is particularly important in palliative care, where patients' health status can change rapidly, necessitating quick adjustments to the care plan. Furthermore, engaging in these discussions early in the disease trajectory, ideally before the patient's condition deteriorates significantly, can improve outcomes by ensuring that patient preferences are clearly understood and respected throughout the course of their care. This proactive approach minimizes the risk of crisis-driven decisions that may not fully align with the patient's wishes. In Mr. Thompson's case, the care team regularly revisits his care plan to discuss any new symptoms or changes in his condition. These discussions are crucial for ensuring that the care provided continues to align with his values and desires, particularly as he nears the end of life. It is also an opportunity to reassess the effectiveness of pain management strategies and the overall approach to symptom control, ensuring that Mr. Thompson remains as comfortable as possible. The care of Mr. Thompson exemplifies the complex interplay between medical ethics, patient preferences, and clinical practice in palliative care. By adhering to ethical principles and employing structured communication tools like the respect form, healthcare providers can ensure that they respect and fulfill the patient's wishes to the greatest extent possible, enhancing the patient's quality of life as they navigate the final stages of life. Thank you for joining this in-depth exploration of palliative care ethics. It's a topic that challenges us to think critically and act compassionately, always putting the patient's values and quality of life at the forefront of care decisions.